Mental Health Disparities TED Talk. My table of contents includes my introduction, 3 root causes, how do we fix these issues, a conclusion, and my cited sources. Hello everyone, my name is Nadia Evans. Today, I want to discuss an issue that I don't think is addressed enough, and as a Black woman, I want to be able to advocate for others such as myself. There are a lot of different issues going on in the world today, but the 3 issues I have seen in maternal health disparities are the social determinants of health, structural inequities fueled by racism, and a lack of community-driven solutions. As once stated, my 3 root causes that I will be discussing are social determinants of health, structural inequities and racism, and community-driven solutions to help with these issues. First, I want to discuss social determinants of health. Now, even though it shouldn't, your tax bracket does play a big part in how you are treated in hospitals. For example, if you stay in a low-income neighborhood, what job you work, or even if you're taking a bus, it can affect how you are looked at in a healthcare facility. One of my articles stated that Black women living in resource neighborhoods are more likely to face discrimination just because of the color of their skin, unlike a white woman who would be worshipped for the ground she walks on. Now, for a Black woman, this can result in conditions such as preeclampsia. Preeclampsia is a condition that is linked to blood pressure issues and sometimes goes undiagnosed because a doctor could say it's normal to have chest pain because Black women are seen as having a higher pain tolerance than white women. On this slide, I have came up with a graph or data showing the descriptive health statistics for women. Non-Hispanic Black women have significantly worse health outcomes than white women, as this diagram shows. Black women had rates of maternal death that are over 3 times as high as those of white women. Black women also had a significantly higher rate of baby and pregnancy-related mortality. Obesity and high blood pressure are more common among Black women, which can increase the risk of pregnancy complications. All things considered, this demonstrates that due to health issues and unjust disparities in healthcare, Black women are significantly more vulnerable throughout pregnancy. This takes me into my second root cause, which is structural inequities and racism. Racism is not just words that come out of someone's mouth. It also has something to do with your actions. In the article, it says that Black women's pain is sometimes dismissed, as I previously said. When a Black woman says that she is in pain, she isn't likely to be believed, unlike a white woman, because we can handle more, which even dates back to times of slavery. Like saying Black women are more assertive or less sensitive to the pain that they are going through, which isn't true at all. All women are equal. Now, sometimes it isn't obvious that a doctor or another healthcare professional is being racist because they can still tend to your issues by giving you medicine to help with your system. But protocol is to have to run tests to make sure that everything is truly okay. Now, this brings me to my last topic, which is community-driven solutions. A way that these issues can be avoided is by having collaborative care within the community, patients, and doctors. A Black woman should always have someone who can advocate for her and show her empathy towards her during her time of need. For example, when a Black woman has doulas and mental health advocates, studies show that they are more likely to feel safer than usual because someone understands what they are going through. A lot of impoverished communities have started community outreach programs to be the voice that these women need when they and where they can go to talk about their emotions without being judged, basically like a safe place for them. On this graph, it demonstrates that addressing maternal health issues, particularly for Black women, requires effort at multiple levels, including those of families, organizations, communities, and policies. A person assists Black women in gaining improved access to mental health services and therapies. Families help support women who are at risk by educating them about mental health and lowering stigma. Organizations provide mental health services in public settings such as jails and workplaces and simplify the procedures. Community establishes powerful neighborhood organization that upholds systemic accountability, encourages mental health, and lessens stigma. Policy establishes financing and legislation to encourage collaboration between community, organizations, and healthcare. So, where do we go from here? After we look over the numbers, we can see how much the world around us can truly cause heartbreak. In the United States, Black and Native women have faced constant trials and tribulations. They are 3 times more likely to pass away from pregnancy-related symptoms than white women. Native women are also more likely to have low birth weight babies and not receive any prenatal care. This shows that there is no biological foundations. These families are also the outcome of bad health care and aren't able to get it when they truly need it. But this doesn't have to continue. On this slide, I have created a maternal mortality per 100,000 births by race and ethnicity from 2018 to 2022. Compared to other racial and ethnic groups, Black women had the greatest rates of maternal death from 2018 to 2022, according to this graphic. Black women had a death rate of 69.9 deaths per 100,000 births in 2021, which was more than 3 times higher than that of a white woman and nearly twice as high as that of a Hispanic woman. Despite a slight decline to 49.5 in 2022, the rate for Black women remains significantly greater than that of other groups. This demonstrates that Black women are more at risk during pregnancy and labor, that the issue has persisted rather than only increased sometimes. How do we fix these issues? For changes to happen, first we need more diversity in our healthcare because trust and communication between a doctor and a patient improves patient health causes. Secondly, we must address the systemic racism that happens in healthcare. During pregnancy, many women feel overlooked, disregarded, and unheard, which can lead to death. To ensure every patient gets fair treatment, I feel as if there should be accountability held against the doctors to ensure that they are aware of anti-racism training and improve cultural awareness of all levels of care. Thirdly, the influence of socio-economic determinants of health cannot go unseen or unheard of. One of the articles that I have created says that that medical care is not the only factor that affects a woman's health during and after pregnancy. It can also be other factors such as housing, money, education, and how much food they can provide. Women in poverty, for example, can put off getting the help they need because of finances and transportation issues. They can also may not have the access that they need to food or safe neighborhoods where they can go outside and get exercise. These things are important issues that need to be included in an intervention plan. One way that we can help with these issues is through community health programs. These efforts prepare locals and healthcare educators to make them activists for these women. In addition to attending visits and advocating, they also help the moms. These initiatives have been tested in states like California and North Carolina and have had positive results, such as reduced infant death rates and more prenatal care for moms. Reproductive justice is also necessary. Not only did laws like Roe v. Wade protect abortions, but they also provided contraception and prenatal care for moms, which most places do not have today because it has been overturned. Women of color already face certain obstacles when it comes to their care, and we must defend these rights and not limit them if we want things to change. Another important component is to look at data and maternal rates in areas like income and race. This helps us spot trends and helps us to react in certain ways to help. In conclusion, this is more than just a medical problem. It is a matter of fairness and human rights. We, as a community, need to make sure that women of color are given better health care and the help they need so that their infants can flourish because our mothers and children deserve nothing less. Thank you for listening to my TED Talk.